prepare for your part in our National Day of Action, and also to give you a glimpse into the larger legislative process. Today's session will be recorded, so if you are listening to the recorded session, thank you for participating and adding your voice to our coordinated efforts. Questions, if you have questions during the presentation, we are going to be answering questions at the end. So you can either hold your question, or if you would like to use the chat feature that is part of the webinar, you can certainly do so. That might be a good idea. Then you can see if someone else is asked your question, and it'll help keep us on track. As Robert said, during the presentation, if you're not speaking, if you would, please keep yourself muted so that we can minimize background noise. Our presenter today is Philip Goglis, as I mentioned, Legislative Director, Health and Medicine Council. Phil is our representation. He is the Scleroderma Foundation on the ground in Washington, D.C. and on Capitol Hill. He has worked with nonprofit health-related organizations for several years, making issues of patient communities heard on Capitol Hill. He understands the unique challenges that those in the scleroderma community face on a daily basis, and he's aware of that because of your willingness to participate in this process and to tell your stories. Your scleroderma stories do make a difference, and you make a difference in this process, and we would not have the success with advocacy that we have had without people like you participating. So thank you. And Phil, thank you for the work that you do on our behalf. And with that, I will turn things over to you, Phil. Thank you.
Thank you, David. Thank you, Robert. And thank you to everybody who has joined us this afternoon and those who are watching or listening to our webinar. First, we're going to go on over some issues and go through what we're going to discuss today. But first, I want to welcome you all again, our National Day of Action happening this year. Next slide, please. And quickly, as David mentioned, just want to give a bit of a background. I know many of you who have joined us live have met you before, whether that be at conference or at our events here in Washington for Hill Day. But I work with the Health and Medicine Council. We are here in Washington, D.C. We work on behalf of the Scleroderma Foundation. My job here is to be the eyes and the ears of the foundation and the scleroderma community, maintaining critical relationships with members of Congress, developing deeper relationships that you all have developed locally through your advocacy, and making sure that our priorities continue to move forward in a positive direction. Next slide, please.
And I'm frozen. 1 second. Well, it worked in rehearsal. Hold on. There we go.
Great. So again, thank you all for participating. You'll see a photo there from a previous Hill Day with our advocates meeting with Senator Ben Cardin, personally sharing their story with scleroderma, asking for his critical support. It really makes a big difference to have you share your story. It again helps legislators understand scleroderma, and it educates them about important information and our priorities. And by advocating yourself, you're not only helping those in Maryland, such as those who are meeting with Ben Cardin, but really the scleroderma community as a whole. Next slide, please. So today's agenda, we're just going to go over a brief review of how Congress works, a little bit of a schoolhouse rock. We're going to go over how to connect with your legislators in the House and the Senate, a quick review of our legislative issues. We'll have some time for questions and answers, and then we're going to have some advice from 3 seasoned advocates who want to share their experience about how to advocate for Congress. Next slide, please.
Pause it, having a little delay reaction, but it should go. Well, give it just a moment. We seem to be having a technical difficulty. Hold on one moment here. There it goes.
Great, thank you. So a quick review of Civics 101. We have 3 branches of government: the executive branch, which is the administration, they enforce the law; the judicial branch, which are the courts, they interpret the law; and the legislative branch, which on the federal level is Congress, they create and enact laws. I know many people will have a question on why do we only engage with Congress, and that's because of the authority that Congress has. Congress has the power of the purse. They decide how much funding each federal agency receives on an annual basis. Congress is in charge of creating specific policies that the courts interpret and the administration enforces, and Congress has oversight over all federal agencies. So by continuing to advocate and educate Congress, we're able to do a lot more for our community. Next slide, please.
So what we're finding is that there's a bit of a slowdown, and I apologize for that, in the computer reacting. It's probably the bandwidth. So just bear with us as it comes. There we are.
Perfect. So all about Congress. There are 2 branches, 2 parts of Congress. The first is the Senate, which is composed of 100 senators, 2 from each state, and they're elected to 6-year terms. It doesn't matter if you live in a high populous state like California or a low population state like Delaware. Each state has the same number of senators too. The House of Representatives is a little bit different. They are elected to 2-year terms. There's 1 representative per district, which is based off of population. There are 435 representatives in the House together, and that number doesn't change. So every 10 years with the census, you have a state like California, which has a lot more people who live there. They have 53 individual representatives for 53 districts, and a state like Delaware only has 1 representative for the entire state. So as opposed to your 100 senators, your members of the House solely depend on the population of the state. With the House running every 2 years, they are always in cycle, and there's always a lot that's going on there. The Senate is only, with 6-year terms staggered, they only have 1/3 that are up for election every 2 years. Next slide, please.
It's working on it. Sorry for the delay. Ladies and gentlemen, I'm going to pull this off of presentation view, so just bear with me a moment, and we will pick this up. I'm going to try another way of sharing these slides. One moment, please. Sorry for the technical problems. Okay. this again. Hopefully you are seeing my screen, but I am not doing it in presentation mode. So hopefully that works a little bit quicker.
Great. Thank you, Robert. So key committees that we work with on the Senate side, you have the Appropriations Committee, which is tasked with developing funding levels for every single federal agency, such as the National Institutes of Health. You have the Health, Education, Labor, and Pensions Committee. Appropriately, it's the HELP Committee. They focus on oversight of NIH, some other federal healthcare agencies, federal healthcare policy, and that's on the Senate side where our bill has been sent to. And then you have the Finance Committee, which has oversight over Medicare, Medicaid, and also deals with important health policies. On the House side, you also have the Appropriations Committee, which provides the similar role as it does on the Senate side, where House appropriators decide how much funding each federal agency receives on an annual basis. You then have the Energy and Commerce Committee, which is the equivalent of the HELP Committee. Energy and Commerce has jurisdiction over different federal agencies, such as the National Institutes of Health, and that is currently where our House bill has been referred to as the Committee of Jurisdiction. And then you have the Ways and Means Committee, which is similar to the Finance Committee. They deal with tax policy, Medicare, Medicaid, and other healthcare related issues. Next slide, please. So how Congress passes bills, that's our friend Bill on Capitol Hill, for all those who don't remember him. In order for a law to happen, a bill must first pass the House and Senate and then be signed in by the president. This process that the House, Senate, and the administration follow not only applies to bills such as ours, but also to must-pass spending bills and appropriation bills. And for bills to move forward, legislators consider feedback from their constituents, which helps them prioritize which specific bills to support and what priorities to work to move forward. Next slide, please. Some federal agencies that we work with, the National Institutes of Health is the premier research agency. There is a lot of good research that's being done at NIH. The Scleroderma Foundation has a very good working relationship with the leadership of NIH and different institutes at the NIH. We also work with the Food and Drug Administration, who decides what drugs should be available to patients. The Centers for Medicare and Medicaid Services, which decides specific policies and coverage. And then the Centers for Disease Control and Prevention, which work on public education and awareness of any number of diseases in the United States. Next slide, please. Thank you. So what do advocates do? Most importantly, advocates educate lawmakers. You raise awareness by sharing your personal stories. You make local connections with your local offices. And at the correct time, you ask for a specific action. The picture you see right there is with Christina, who you'll hear from in a little bit, our other co-chair of our advocacy committee, Rosemary, Christina's daughter, Claudette, and Congressman Peter King, who is one of our leads of our bill. And the reason why he does that is because of the local connection he has to members of the tri-state chapter. Next slide, please.
Sorry.
And a critical mass of support is how we're able to advance our key priorities and to get Congress to support specific initiatives for us. As an individual, what you're doing during our National Day of Action and throughout your advocacy throughout the year is you're advocating as part of a national grassroots effort. You'll see the many people who are on our discussion now from all over the country, and you are a key influencer for increased research funding and overall improved healthcare for the scleroderma community. Next slide, please. Together as a unified voice on June 29th, Our community will continue to educate, inform, and influence legislators, asking them to create meaningful change. And everybody who is participating plays an important role in our goal, which is finding a cure for scleroderma. Next slide, please. Now, to contact Congress, first, we're going to ask you to prepare for June 29th, Day of Action, by reading, reviewing the materials provided by the foundation. We're going to ask you to call your representative's local district office and ask to speak with their staffer who handles health policy. And we're also going to ask you to request the name and email address of the DC-based health staffer. This way, you're able to share your story and connect with your office locally and here in Washington, D.C. We're going to ask you to follow up with the staffer you spoke with via email and continue to stay in touch with them throughout the year, updating them on key activities, not only that the foundation is doing, but key updates that affect the scleroderma community. What's critically important is to develop these relationships and to stay in touch. And remember that advocacy is not just one day out of the year, but it truly is 365 days a year. Next slide, please. To find your senators, you just have to go to www.senate.gov. From there, you will be able to use the Find Your Senators search function. It will provide you a link to their website, which will have their contact information, contact forms, and different ways to connect with them, such as where their offices are located. We encourage you to use that information to call whichever office is closest to you and to sign up for any mailing lists, newsletters that they have, and to follow your senators on social media, because they will regularly update their constituents on what's happening, not only here in Washington, but back home as well. Next slide, please. To find your member of the House of Representatives, it's very similar. You go to www.house.gov. You're going to use the Find Your Representative search function by entering your zip code at the top of your screen. It's critically important when you're on the House website, though, to make sure that you put in your full address, because the way many House districts are drawn, you may be in a situation where on one side of the street, you're in one district, but your neighbor across the street is in another district, or your zip code is split into multiple districts. So it's best to put in your full address in the search, so that way you're able to find exactly who your member of the House is. And again, it will give you a link to their website with online contact forms, location of offices, phone numbers, as well as the option to subscribe to newsletters and the option to follow them on Twitter and Facebook. And as mentioned before, a key difference between the House and Senate is the House of Representatives is up for election every 2 years. So currently we are in an election year. So we do encourage you to follow your representatives on social media, sign up for newsletters, so that way you can be kept up to date on anything and everything that they're doing throughout the summer and through the end of this current Congress. Next slide, please. Many folks will have a question of how do they prepare if they have never advocated before, if they've never participated in our efforts, or if they've never reached out or connected with their members of Congress. We have put together any number of materials that are available via email if you receive them, or they're posted on our National Day of Action resources page. It contains our prep packet and other helpful hints to prepare for your conversation. Make notes of any questions you may have for the staffer you're going to be speaking with. Prepare your scleroderma story. How has it changed your life? Again, anything that we talk about here policy-wise, it's good to know, but that's not the most important thing. The most important thing for you to remember is to share your story. That is what you are an absolute expert in. We encourage you to write your story down, to practice saying it out loud several times, keeping it to 3 to 4 minutes if possible. And in the prep packet, we provided a call and email script that we're going to ask you to follow as well. Again, it doesn't require you to worry about any of the specific policy requests, but it allows you to include your story. And again, that's what you are the first and foremost expert in. Next slide, please. Following connecting with Congress, we're going to ask you to send feedback to the foundation. Let us know, how did the conversation go? Were there any questions that the staffer asked that you believe we should follow up on? If there is a question that somebody asks you that you don't know the answer to, it is perfectly okay to say, I don't know the answer, but I'm happy to get the information. I'm happy to get the information for you and provide that question to us, and we're happy to follow up with them. It's helpful for us to know, who did you speak with? Who did you email? Did you get a reply? How was the conversation? What was said? And to send all those to us at advocacy@scleroderma.org. But my job here in Washington is to take all of the information and the feedback that you provide and follow up with offices. So if you spoke with a House member from Texas and they were very eager to do something for the community and work with us, I would then get that information, follow up with their office here in DC, provide them with specific information, and work with them on the policy side to build off of that contact and relationship that you began. Next slide, please. So I want to do a brief Washington update, just a review of the issues. Again, all of this information is good to know, but it's not absolutely necessary for you to memorize everything that we're going to discuss. We are in the second session of the 116th Congress. So every Congress is 2 years. The first session was last year. We are currently in the second session. After December of this year, come January of 2021, it will be the first session of the 117th Congress. So as this session is coming to an end and we are in the current calendar that we are in June, there is a lot of continued focus on annual budget and appropriations activity, as well as healthcare policy, which includes medical research, patient access, and specifically our bill. Next slide, please. So first and foremost, our bill, the National Commission on Scleroderma and Fibrotic Diseases Act, it was introduced back in 2019 in the first session of this current Congress. And this bill will, at no additional cost to the federal government, establishes a national commission that will study the incidence, duration, and mortality rates of fibrotic diseases, evaluate facilities and resources for the diagnosis, prevention, and treatment of fibrotic diseases, and develop a long-range plan that establishes NIH collaboration within a working group focused on fibrotic-related research. Now, every new Congress, such as the 115th or the 116th Congress, we do reintroduce the bill. This current bill that has been introduced is for the 116th Congress. So we are working to pass it by the end of this year, which is 2020. On the House side, it's led by Congressman Peter King from New York and Congressman Elliot Engel from New York. As you see, a Republican and a Democrat. We have strong bipartisan support from both Republicans and Democrats. We have 45 co-sponsors on our current bill as of last week. On the Senate side, our Senate bill is led by Senator Kirsten Gillibrand from New York, and we have bipartisan co-sponsorship of our Senate bill as well. One thing that the foundation prides herself in is that we work with both sides of the aisle. Scleroderma is not a political issue, but it really is a patient-centered, patient-focused issue. And we're glad that we're able to bridge some of the divide by working with every member of Congress in getting their support. So once this current Congress ends, if we have not been able to pass our bill, we will be working on a reintroduction of our bill come the next Congress, because this current bill is only for the 116th Congress, which ends at the end of this year. Next slide, please. So funding is critical. Funding at the National Institutes of Health. Currently, NIH is funded at $41.6 billion, and NIH coordinates our federal scleroderma research through NIAMS, which is the National Institute of Arthritis, Musculoskeletal, and Skin Diseases. The foundation has a long history of leadership within NIAMS related issues. Robert is a past co-chair of the Friends of NIAMS group. Rosemary, who is co-chair of our advocacy committee, is a member of the advisory council for NIAMS, where she shares the concerns of the scleroderma community in terms of research and different activities that NIAMS supports and NIH supports overall. NIH funding is critical to continuing to advance our understanding of scleroderma and get towards that cure for scleroderma. We're asking this year for Congress to provide at least $44.7 billion in funding for NIH, and we're asking that all public health programs receive meaningful funding as well. The larger patient community supports robust NIH funding, so the Scleroderma Foundation and the scleroderma community is not alone in asking for this specific amount for NIH. Next slide, please. We also are supporting peer-reviewed scleroderma research at the Department of Defense. I know that many people oftentimes will ask why the Department of Defense is doing health research, and that's because every year they create a list for the peer-reviewed medical research program where they list specific conditions that they deem eligible for study that have a connection to military service. For many years, scleroderma was part of that specific program. We were listed as a condition eligible for study. Our researchers successfully competed for grants and received millions of dollars worth of funding to support scleroderma-related research. And because of our advocacy over the years, last year, Congress created a specific scleroderma research program at $5 million. So instead of scleroderma being one of 35 conditions competing against each other for funds, Congress created a specific peer-reviewed scleroderma research program, funded it at $5 million. The foundation has been incredibly active in the implementation of the program and making sure that the voice of the scleroderma community is heard and that we continue to have an active role in the implementation and the success of the program. This doesn't happen every year where Congress decides to give a new dedicated line item worth of funding. And the reason why the scleroderma program was created is a direct result of the many years of advocacy work of all of you who have educated your members of Congress about the importance of scleroderma, educated them about why they should support increased research for scleroderma, and develop them into champions for our community where they decided to create this program. So we are asking for continued support for the peer-reviewed scleroderma research program in fiscal year 2021. We're asking Congress to maintain the $5 million worth of funding moving forward because there is a lot of great work that will come from this specific program. Next slide, please. We also focus on our 4 pillars of patient protections. We very much are in favor of the prohibition of pre-existing condition discrimination, prohibiting lifetime and annual caps on health insurance benefits, allowing dependents to stay on their family coverage until they are 26 years old, as well as limiting out-of-pocket costs for patients. The Scleroderma Foundation, as part of the larger patient community, has been active for several years to ensure that Congress remains supportive of these important 4 pillars. We know that over the past few years, there has been a lot of conversation around healthcare and what types of reforms or new programs would be created with regards to healthcare. As mentioned before, we don't approach anything in a partisan lens. We work very closely to ensure that what's best for the patient is what's done. So many years ago, we have developed these 4 pillars that we have based all of our review of any proposed policy changes or fixes on, and making sure that all 4 of these are continued to be included. So we're asking folks to remind their legislators about the importance of these 4 pillars and why it makes a difference for the scleroderma community. With that, I'm going to ask for the next slide, and I'm going to introduce Susie Ballantyne, who is one of our co-chairs of our advocacy committee from the Tri-State chapter, who is going to share her perspective about what it is to advocate. So Susie, I'll turn it over to you.
Okay, thank you. Now we've all listened to a lot of information, and sometimes, you know, I'm a patient and you start thinking, oh no, I would never be able to do this. But they're just giving you this information to put it into context. Your job is not to go into the details of the policy. And most congressional offices aren't expecting that. What our job is to tell a story. You need to paint a picture so that they understand what it's like to have scleroderma. They're not expecting you to be the expert. My favorite line is, I will have somebody get back to you shortly. And Phil in the national office is excellent at doing that and making sure that that information gets to the office. But really, you want to paint your story, and that's what you want to practice saying. You want the information that's there and you want to review it, but you do not have to be the expert on everything that's in the bill. And most congressional offices aren't expecting that from you. How I envision it is, I was just trying to think of an analogy before I got on the phone, and it's really the difference between a dictionary versus a painting. So a dictionary, both are very handy. And if we're talking about scleroderma, somebody has to know these policy decisions and advocacy, and that's what Phil and Robert, and they all know about that. But you're the one that is drawing a painting and illustrating so that a congressional staffer, ultimately the congressman or senator, really understands what scleroderma is. And they can't do that part. If they could, we would all just hire them and we'd be done. But it really takes each one of us making that painting so that everybody can actually visualize what scleroderma is and how it affects people. So that's my point of the day. Anything else, Robert or Phil?
Thank you, Susie. I think you hit the nail on the head with that. I couldn't do my job successfully here in Washington if it wasn't for all of you. We don't need you to memorize every single detail about specific funding for NIH or key parts of the bill. It really is important for you to share your story. And if it wasn't for the countless advocates who have shared their story and have educated their lawmakers over the years, we wouldn't have as much success as we have had in the past year and the past 4 years. You know, I could go to every single Senate office and every single House office, walk in and tell them why it's important to support scleroderma-related priorities. And, you know, humbly, I think they will listen to me and they would do it. But what really makes the difference is when Susie walks into a New York office and says, hi, I'm a constituent. When Joey walks into a Missouri office and says, you know, I'm a constituent and this is what I hope you will be able to do for us. And that's really what makes a difference. So it really is an honor and privilege for me to work as a team with all of you who advocate to make sure that our priorities continue to be supportive. Robert, David, if there's nothing you want to add to that, I think we can turn it over to Christina.
Thank you. Thank you both for those comments. And no, we're happy now to turn it over to Christina Locke, who is a member of the National Board of Directors for the Scleroderma Foundation. She's also a parent who has a child living with scleroderma. So Christina, please join the conversation.
Hi, it is nice to be here with all of you. Thank you for the introduction. I'll just share that a little bit about how I brought my daughter into this. My daughter was 9 years old when she was diagnosed with scleroderma, and it all was so head spinning and fast that we felt like we had to do something, and my daughter was sort of right on board with that. And the first thing that I can say is that being an advocate in Washington, D.C. is actually fun for a kid. There's something about going into those buildings and having appointments at all the different offices. And there's actually a themed snack inside each office, which is also very, very fun for the children. And the attention that kids get. Children are so welcomed in all of the offices. We've done it a few times now. And I think we've been 3 years for Advocacy Day. And my daughter was so disappointed that that this year it's going to be virtual. So it actually is a lot of fun, unexpectedly. And also she's a mini superstar with her social studies teachers at school when she gets to say, I can't come into school for the next 2 days. I'm going to be lobbying in Washington, D.C. So when we show up at a meeting, I introduce myself, and then I try to turn it over to my daughter as much as possible. So rather than arrive with a speech that I'm going to give, I tend to have in my mind a series of prompts and things that I think she could add to this conversation, because she's the kid with scleroderma, which is pretty rare. So like, for example, I'll give one example of things that I knew I wanted my daughter to say. Not only last year, I'm in 7th grade, or I was in 6th grade at the time, and I'm 11 years old, and I attend the same middle school as our Congresswoman's daughter. That was one thing I wanted to make sure she said. We happen to live in the same town as our Congresswoman, so that was fun to bring in. We are usually the only children in the group, if not in the office, if not one of the few children in the entire building, so that's also very special. And as far as adding to the conversation on scleroderma, we're able to talk about how misunderstood the disease can be within juveniles as well as with adults. So we try to expand the conversation whenever possible. Even people who are familiar with the disease or who've had other visits before from scleroderma advocates often say, I didn't realize that kids could get it. And we use that as an opportunity to talk more about Claudette's experience. Whereas, you know, what she adds is often a comment in contrasts to what a lot of other people have said. And I just work on prompting Claudette to add that to the conversation, to add sort of another face to the idea of what they think scleroderma is. But I cannot tell you how receptive the offices are to including children. It has been nothing but smiles and a positive experience, even when she's the only kid around. And usually there are a handful of kids on the bus at the Hill, you know, in the larger scleroderma group, but it's very special. And the snacks are great too. So that's about it. Thank you.
Thank you, Christina. I appreciate sharing those insights. And finally, we'd like to invite Tina Fellows, who is the executive director of our Ohio chapter, to give her perspective as well. So Tina, I believe you're off mute. Please contribute to the conversation.
Yeah, sure. I have just kind of a funny story that goes back to 2015. And I was just hired with the Scleroderma Foundation and attended my first national conference in July. And I went to the Advocacy workshop with Dane Christensen, and who is a colleague of Philip's, and listened to the workshop. I decided it didn't sound like anything that was that hard, and the Ohio chapter really hadn't been very involved in advocacy up to that point. So the board was really excited that I was gonna, you know, start working on this effort. So I went right home, like 2 weeks later, called up Congressman Steve Stiver's office, who is, you know, just about 30 minutes from me. And I didn't take a patient with me or anything. I just called up, made the appointment, went ahead and went in there, and was talking to his legislative aide, who the appointment was with. So I remembered all the important points. You know, it's a bipartisan bill. It is not asking the federal government for any additional money, and we just think that scleroderma really should be the prototype disease to be studied because it does affect fibrosis in every area of the body. And so I went through my whole spiel and handed her what I had, which I didn't know at the time was a draft of the bill with a blank at the time at the top of the paper where it should say the bill number. And so she was looking over it and she says, okay, this looks, really interesting. Can you tell me what the bill number is? And based on the fact of her response, I must have had a very deer in the headlights look, because she said, it's okay, don't worry about it, I can just look it up. And so, sure enough, we ended the meeting, and a week later, I found out that he did indeed co-sponsor the bill. So that just goes to show that they are not expecting you to be some kind of expert. And if there's something you don't know, they're very gracious and, forgiving. And they just, you really are there to be just a tool to bring the information to them. So if you're willing to give a little bit of your time and just share, what this is about, that's really all it is. And it's not about being any kind of an expert or anything like that. So just wanted to add that so that you can have confidence that you can make, mistakes and you can still be successful.
Thank you very much, Tina. Appreciate you sharing those insights. Yeah, it can be nerve-wracking at first, but it's everyone has been new at this at one point, and there's nothing that could be done that would hurt our work or cause by forgetting something. They understand that, and we can always punt when we need to. So thank you for sharing. David, I think I will advance this slide deck, and I think, David, you're going to talk about questions?
Yeah, so there was one question that was asked in the chat group, and I'll repeat that. I think Phil's spoken to it, but we're just going to address it directly again. The question was asked, if all bills will still be on a 2-year track, with Congress not having been in session so much this year, if that's the case, does that mean that our bill has to be passed by the end of this year, or will we have to start with a new bill in the next session of Congress?
So I will say that COVID-19 has truly upended the legislative agenda for Congress this year. There were high hopes, even for Congress, to get their work done this year. In an election year with everything else going on, there was still hope that appropriations would be done on time. Some key priorities regarding policies would have been passed. All of that was definitely upended by COVID-19 and the federal government's response to it. Currently, Congress hasn't indicated any movement on non-annual related bills such as appropriations and some things that they must pass before the end of this year. They, on the House side, have been working the entire month of June to finish off appropriation bills. They're going to come back for 2 weeks in July to work those through their respective committees and try to pass those through the House before they break for their traditional August recess. But we still are on that 2-year track for our bill. So we will continue to advocate for our bill until the last day of the 116th Congress. But if it does not get included because of a lack of floor time, where Congress is really just focused on moving annual bills forward, we will have to begin anew next year in the 117th Congress. And one key difference is going to be that Congressman Peter King, who has been our lead Republican on our bill for the past few Congresses, is retiring this year, so he will not be back in the 117th Congress. So we are continuing to add co-sponsors, add champions and supporters, so that way we can develop a new Republican who will take the lead on leading our bill in the next Congress. I see another question here, David, that I can address that's similar to what we've kind of been talking about. So the question is, can legislators still co-sponsor bills as they usually have to be in DC? Yes, they can still co-sponsor bills even though they're not in Washington, DC. All it takes is them to give the okay to the member to give the okay to their staff, who would then, if they are a Republican, would reach out to Congressman Peter King's office. If they're a Democrat, they would reach out to Congressman Elliot Engel's office, and they would say, hi, Dina, please add my boss to the bill. He or she wants to co-sponsor the bill, please add them. So instead of everything going on with COVID-19, I know it really has upended a lot of the work that we normally do, but I will say that Congress has responded in a positive manner, in that there hasn't been a week that's gone by since March that I haven't had multiple conference calls with staffers, with members themselves, about advancing key priorities. So Congress is still, on the staff level and even the member level, still working to move the needle on legislation, not just related to COVID, not just related to appropriations, but to all of the other legislative priorities that have been moving forward. So it is still, because I know some folks have the question too, is in light of everything going on, is it still appropriate to contact your office and speak with them and make these requests? And the answer is yes, because they still are there working for you.
Thank you, Phil. We've got time for another question or two, if anyone has a question. So here's a question of, should we call to make an appointment with the Congressional Representative's office, or just, I guess, cold call on the 29th? Should it be a scheduled call or just a pick up the phone call?
So I would say either one would work. I know that there are a lot of folks who live in the same area. If you want to get together with your fellow advocates in a specific area, such as Ohio or the DC area or the tri-state area, and want to work on setting up a conversation with a specific office, that's good to do. But for those folks who have never participated in advocacy before, it's okay to cold call them and connect with them and ask to speak with the appropriate staff member. Each office keeps a record of who calls, what they call about, and how many times they hear about a specific issue. So if we do have a mix of some folks scheduled a meeting and they spoke with a staffer, and then that staffer got 20 other phone calls about the same thing, that's a positive. If they only had the interaction with a scheduled group, that's okay too. With a virtual event like this, the strength is definitely in numbers. So the more outreach offices receive, the more likely they are to bump it up on their internal legislative roster about checking in and making a decision on whether to support our bill.
So Phil, a related question. So if I were to pick up the phone and call and kind of follow the script that's in the resources that we have online in the prep packet, the narrative for the phone call, you know, I'm probably going to get a staff person who answers the phone. If I am on the phone for 30, 45 seconds to say, I'm David Murad, I'm a constituent of Congressman Moulton, and I'm calling to ask him to co-sponsor House Bill 3446. Is that really enough? Is that really all they want? Or do I need to talk to that person for 5 minutes and tell my story and a little bit about why this is important to me? Or can I just 30 seconds, this is what I'm calling to ask for?
So I think you would experience many different types of staffers. I know some staffers who can talk to you for a half hour and will be engaged in questions. Some you'll only have that opportunity to have those 30 seconds or a minute. That's why we're encouraging folks to get the name of who you speak with if you call the office, get their contact information, and then get the contact information for the staffer here in Washington. If you're only able to have those 30 seconds to a minute, but then you get their contact information, you can then follow up with them and provide all of the information from the email script to them. And that way you develop a line of communication with them via email.
Thank you. Well, I think we've got time for another question if anyone has a question. You can certainly send questions. If you send a question to advocacy@scleroderma.org, it will go directly to me, to David Murad, and I will do everything I can to get an answer to your question. I do want to thank everyone for participating. I really love what Susie, the image that Susie shared about the difference between being a dictionary and a painting. And so we want you to be part of this mural, this painting that we are creating. And the bigger the mural, the more it's going to be seen and communicate a big story. So we want your brush strokes as part of this painting. And so thank you all for participating in this portion as we lead up to our National Day of Action a week from today on June 29th, which happens to coincide with World Scleroderma Day. Thank you all. Thank you, Phil, Susie, Christina, Tina, Robert, and everyone who has participated in this call and will participate, and for those who are listening to the recording. Thank you all, and we look forward to being in this process together. Thank you.
Have a great day, everyone.
Thank you. Thanks, everybody.